Hey everyone, this is Kelsey, and this is my project, my lightning strike for the medial tibial stress syndrome or shin splints. So when I first got my rotation, I was placed with women's basketball, and it was exactly like this as soon as I walked in. Every other athlete that I saw was complaining that they had shin splints or that their shins hurt, and I didn't really know what shin splints were, although I knew it sounded pretty painful and that they couldn't do exactly what they had been doing before. And every time I thought about it, all I could think of was the tibia was just splintering bone shards into just surrounding muscles. That's all I could think about. Until I Googled it, and this is what I saw. The highlighted part for on your left is the MRI scan of shin splints. It's definitely not the splintering bone that I had expected. So when we were giving our lightning strike presentation, I decided to do mine on medial tibial stress syndrome to learn a little bit more about it, and to be able to connect with my athletes a little bit more so I could help them when they came in saying that they had shin splints and I wasn't thinking that they had splintering bone in their leg. With my research, I found that it is a stress injury due to repetitive landing, jumping, and running. It occurs mainly in the anterior tibial area, and then it's basically due to the body not being able to recover, and it causes pain to the person almost to the point where where some can't even walk or run. I found that in 1977 it was rated the third highest injury in the Runner's World Survey. And in basketball, I found that there's a lot of running, there's a lot of landing, jumping, leaping. So it makes sense as to why my athletes would suffer from MTSS or shin splints. So with my research and my articles, I found that there is no cure for shin splints or MTSS. They are still doing a lot of research and finding out what exactly causes it so they can hopefully find a way to prevent it. But right now they have a lot of different treatments for pain. With my research, I found that there are two main ones that I looked at. One was kinesio tape for the lower leg, and then one was a Lodi arch taping. So this is the kinesio taping. They use a basic Y strip they start it at the anterior portion of the tibia. It comes down, crosses over the medial malleolus, and then down into the middle arch of the foot. This basically helps with the reduction of the amount of pronation that the athlete has. Pronation is one of the main causes of MTSS, or excessive pronation. So this will help reduce that force, and then in turn will decrease the stress and causation of the injury. They also found that this taping slows the athlete's time to peak force. They found that people with MTSS had a lower rate, causing stress on the medial tibial plantar aspect, also leading to MTSS. They also found that those with the higher rate didn't suffer from lower leg pain. So this Y strip will help prevent that. Next is the Lodi taping. So this is another taping that I found that a lot of ATs or clinicians do for their patients that suffer from MTSS. So this taping more so affects how the athlete walks or their gait. This is removing the stress that they get from different arch types from their hip and knee area. Reducing that hip and knee stress can also help with the stress on the tibia due to how they walk. So this one also helps with the pronation. And this removes stress from the surrounding muscles of the tibia. The two main muscles that help or that MTSS affects are the tibialis anterior and tibialis posterior. So this taping removes that stress from those and helps place it on other muscles based on how the athlete will be walking. In turn, recruiting these other muscles will relieve the stress that's put on those two muscles and basically balance it all the way around. I felt like this was a really good picture to show a normal position of the foot. This is with their weight on the left is with their weight evenly distributed. They aren't causing any stress or strain to any part of their foot or any part of their lower leg. But the picture on the right is their excessive pronation. A lot of athletes suffer from this, which causes the MTSS. And then you have this excessive pronation along with their jumping and running and landing on this obviously causes a lot of stress. So comparing these two, I have done both the kinesio taping and the Lodi taping on myself. With the kinesio taping, I didn't feel like it had done much for my leg. I also don't have MTSS, and I did not use it for practicing purposes, but just the feel of it walking around, I don't feel like it did much for me. I did do the Lodi taping as well. I definitely felt a change in how I walked. I could feel the pulling of my arch being pulled up, and I could see definitely how it would change your gait and definitely change the stress of the muscles in the lower leg. Another thing that I read with my articles was that they encourage their athletes to do a lot of stretching and strength conditioning. Pretty much all but one, I think, article asked their athletes to do a little bit of stretching and strengthening and conditioning. So if it were up to me with my athletes who suffer from MTSS, I would definitely get them on a stretching and strengthening program just to make sure that they're definitely using their tibialis anterior and posterior, but that they're using all their surrounding muscles so that way they aren't being stressed as much, which in turn would help with their MTSS pain, I would think. I would also recommend the Lodi taping. I definitely felt a change in how I walked and in my arch. And I think over time, with the changing in the arch and how the foot is positioned, that it would definitely change the amount of stress placed on the leg. So yes, if I had to choose a treatment for my athletes, I would choose the Lodi taping. I feel like I felt the effects of it just myself in only walking around, so I could only imagine the effects with my athletes as they were practicing or engaging in their sport.